Before we begin reprocessing in EMDR, we start with something called the history taking phase. And it's one of the most important steps in the EMDR process. The history taking phase is the part where your therapist will get to know your story. And so this is going to involve talking about your present, your past, and also what you want your future to look like. This includes a lot, covering the overall problem, what it is that's bringing you to therapy. So maybe you're dealing with anxiety, depressive symptoms, maybe there's issues of panic, and we'll dive into what those triggers are. What are some of the triggers that bring up those issues for you, those symptoms that you're going through? So there's a lot of focus on the present, and it will tie into the past because there may be some memories, there may be some situations from the past that fuel some of these symptoms and some of these triggers that bring out the symptoms currently. In this history taking process, also your therapist is going to ask you, what do you want your response to look like in the future? What's that future template for how you're going to handle these triggers when they come up again after you've completed the reprocessing part of EMDR? Your therapist is going to work with you to understand your memories, your beliefs, your thoughts, the images that come up when it comes to these triggers and these memories, either through some direct questioning or maybe even through some specialized techniques. Your therapist is going to elicit a lot of this information that's going to be useful for creating the plan of the present triggers that you want to work on, for the plan of the memories that you want to approach. The goal is to build a roadmap together. So you and your therapist are going to work at your pace, whatever's comfortable for you. The history taking phase doesn't just cover one session, it can cover multiple sessions. It really depends on how many triggers, how many memories that come up in relation to those triggers. And so your therapist and you are going to take as much time as you need, and also keeping in mind how comfortable you are in sharing all of this material. The history taking phase of EMDR is also about resources. So what are your strengths? What are your social supports? What's your ability to currently manage emotions? So that way, when you start the reprocessing phase of EMDR, you feel emotionally grounded and stable. So if you're wondering what happens before the eye movements begin, this is it. It's a careful, compassionate process that really gets to know your story before beginning reprocessing in EMDR. If you like this video, make sure to hit the subscribe and like button, and be sure to check out my next video, which will cover the preparation phase of EMDR, getting into self-regulation techniques.